Mr. Chair. You may remember that April 29th was my daughter's birthday. She turned 10. And I always remember her birth because we both almost died. I mean, you remember every birth, but we both almost died in childbirth. And that crystallized for me our maternal mortality crisis in a way it hadn't been crystallized before. But the next day, on April 30th, the CDC released preliminary maternal mortality data that showed maternal deaths went up in the past year and continue to go up as America has the highest, or one of the highest, if not the highest, maternal death rates of any industrialized nation. There's a correlation, no surprise, between the states that have abortion restrictions and the states that have the highest maternal death rates. Now, there are a wide variety of reasons, and yes, part of it is the number of women who have been denied access to abortion services, even where there are exemptions for the life of the mother, consistent with the Hyde Amendment, because when a woman shows up at a hospital in Texas or Georgia in the middle of a miscarriage, the hospital's like, why are you close enough to death? Let's sit in the parking lot until you're septic. And we've seen women die as a result. We've seen women die because they were forced to carry a pregnancy that is non-viable longer than necessary under abortion bans. But we've also seen women dying because they were not healthy before they got pregnant. Among the highest causes of maternal deaths are cardiovascular issues. Often, a woman will have her first heart attack as a result of being pregnant or in the postpartum phase, or her first stroke. Substance abuse issues, cancer, these are among the leading causes of maternal deaths right now. And that's why Planned Parenthood provides so much more than abortion services. Cancer screenings, diabetes screenings, high blood pressure screenings. In many cases, they're the only pharmacy in a pharmacy desert that provides comprehensive contraception. And not just the one that the local pharmacist approves of. Because if you're like me and you almost died in childbirth, and I'm gonna tell you my age, you're 52, but you're technically still in childbearing years. But you know if you get pregnant again, you're likely to die. And your doctor says, you know what, you're more likely to have adverse complications from the pill, you need an IUD. But there's some pharmacists who say, I don't approve of the IUD. I don't care what your doctor says. I'm not giving it to you. Planned Parenthood doesn't do that. Planned Parenthood says the choice of contraception that you and your provider think is right for you, we're going to give to you. And, oh, by the way, you're defunding a provider that in some areas is the only OB nearby, because now we have so many OB deserts, primary care deserts, pharmacy deserts, where Planned Parenthood fills that gap for non-abortion services. While you are, for women of childbearing ages who fit in the Medicaid expansion universe but aren't pregnant yet, you're making it more difficult for them. If they make $300 a week, they got to pay a copay now to go get their preventative care. I mean, the cumulative effect of everything we're doing is not going to make our maternal mortality rate go down, but go up. And let's talk about the Hyde Amendment, because you know what is excluded are those fetal abnormalities or non-viable births where you know, and we've heard these stories, where the minute the umbilical cord is cut, in some cases, that baby's gonna suffocate. And these are uninsured under federal health plans, and therefore when they're in the hospital, and the hospital says they treat them as if they're uninsured, and they have to pay full freight under the Hyde Amendment. I would love to have a larger conversation about that one day, but not now, so I yield back.